just gotten so complicated for the individual employee to figure it out. And I would argue for the employer to make sure that their employees have the best benefits that they can afford, because ultimately, when you're trying to compete, you may have, like companies, but it really is and will be your people that will differentiate you from other businesses out there.
The Small Business Rundown is the official podcast of the National Federation of Independent Business, the member-driven voice of small business. NFIB and our members advocate to keep America's small businesses strong and independent in Washington, D.C., all 50 states, and the nation's courts.
Welcome to the Small Business Rundown, a bi-weekly podcast with information on independent businesses' victories and challenges in Washington, D.C. and state capitals. I'm Adam Temple, NFIB Senior Vice President of Advocacy. NFIB member Marcie Strouse traveled to Washington, D.C. to testify before a subcommittee of the U.S. House Committee on Ways and Means about modernizing American healthcare. She joins us today to shed some light on the challenges small businesses face in offering health insurance to their employees.
Thanks for having me. I'm excited to share what I know about the health insurance space and make some meaningful change.
United States Representative and NFIB member Kevin Hern will also join us to talk about key healthcare legislation in Congress. And we welcome NFIB's Principal of Federal Government Relations, Josselin Castillo, back to the podcast to explain some of small businesses' top priorities in healthcare policy.
Thanks for having us.
So, Marcie, you are testifying later today. We're going to talk a little bit about what you're going to tell members of Congress, specifically the House Subcommittee on Health of the House Ways and Means Committee. But before we dive into that, can you just tell us a little bit more about your business?
Yes. So we are proud members of NFIB. Our agency out of Des Moines, Capital Benefits Group, is a health insurance agency. So we work with employers and individuals in that healthcare space. We celebrated 5 years last year.
Congratulations.
So, yes, thank you. Very excited about that. Our main focus really is employer coverage and benefits for employers. So I've been in the industry for over 20 years now and seen how much things have changed over the years and really how important independent agents are for these purposes with healthcare benefits.
Right. And what motivated you to come to D.C. to do what you're doing today, to share your perspective with members of Congress?
Well, the biggest issues that we face today are the cost of healthcare. And so for us, any opportunity that we have to share the challenges that we see our clients and then ourselves faced with in this health insurance market, we want to make sure that they're recognizing the challenges and we're bringing some solutions to the table. So being able to focus on some of the things that feel like fairly easy solutions to some problems are at least going to get us moving forward on some of those solutions. But ultimately, the cost of healthcare is really the biggest challenge that we have to face.
Yeah. For your clients, I'm sure you, as a small business owner for yourself, are you able to offer health benefits to your employees?
We actually have a very robust benefits package. We have 6 employees, so we're a pretty small business. We do not have health insurance, though, for our company. And the main reason for that is we haven't had a need for it. Our employees have coverage through either their spouses or, to give you an example, my family's on a grandmothered plan that we've been holding on to for dear life. And so I wouldn't go onto a group plan even if I had it available to me. So for us, what we've done is just made a point to make sure that we have additional benefits in place. So we cover things like disability and life insurance. We also have even legal coverage and accident plans and things like critical illness. So for us, we have just tried to make sure that we're putting in a benefits package that can supplement the health insurance that they might have outside of our agency.
Yeah, that makes sense. Why is that important to do that for your employees?
Well, for us, it's a retention tool, and we want to make sure they're taken care of. And so right now, regardless of what health insurance plan you're in, your out-of-pocket costs have gone up so significantly over the years that you might feel like your benefits, your health insurance is really great, but you could also have a $9,000 out-of-pocket maximum. So if you have a chronic condition or, you get in and all of a sudden you have a critical illness situation, then that type of coverage would be able to come in and pay a lump sum to help to offset expenses, not only for your medical deductibles, but also just your daily living expenses.
And you mentioned some of it, but what are the biggest obstacles for employers to provide health insurance for their employees?
It's truly the cost. It's 100% the cost. I mean, we have a lot of microgroups, meaning we have clients that have less than 5 employees that are offering benefits. But the biggest challenges are making sure that what they're offering is going to be the most competitive at the lowest cost versus maybe somebody going into the marketplace and receiving some sort of a subsidy to offset their premium.
Josselin, NFIB recently released a policy paper on the affordability crisis when it comes to healthcare. What are some of the key findings that you saw out of that?
Yes, Adam, you're absolutely right. And unsurprisingly, the findings and the prognosis are very dire and very scary, yet it's very little talked about. As long as NFIB has been conducting research on the small business half of the economy, we know that the cost of healthcare has been the number one perennial chronic challenge for small business owners. Data now shows that small business owners pay twice as much for healthcare as large businesses. For instance, premiums have gone up in the last 10 years by 120%, which is unconscionable. Yeah. And the reason for that is, a lot of perhaps well-intentioned but really bad policy coming out of Washington, D.C. that has reduced options. We have fewer insurance plans. We have less opportunities for employers that are small to offer insurance. And so what has that done? It means that our businesses are having to raise their prices, take a profit loss, and in many cases hold off hiring and really, really compete for talent and sometimes be at a disadvantage. And so this really has not only impacts for those communities and those businesses, but for the macroeconomy, I think, writ large, including our national debt. So we paint this picture for Congress to realize that it is important that small business owners are empowered with more, not less options, and customizable because, healthcare is personal. So businesses should have the option to pick the plans and the coverage that best fit their needs and the needs of their employees and their budgets.
So, Josselin, what steps can Congress take to address the issue?
Yeah, I think first and foremost, they need to proliferate the market with more insurance options. We're seeing fewer at this point. We've talked about some of them, things like health reimbursement arrangements. These are some new innovative tools that are available to businesses that want to provide defined contributions, allowing businesses to band together to buy insurance as a large group. There's level-funded insurance. There's a lot of things out there that right now the law is keeping from small employers, but in a way where larger businesses have a little bit more flexibility, so it's unfair. So more options, and then there's definitely a lot that we can do to provide incentives to small business owners, especially those who don't offer healthcare, and a lot of our self-employed, solopreneurs who don't have employees who are really struggling with the cost of healthcare, like tax credits, for instance, or tax-advantaged accounts that they can save for healthcare, and they can spend their dollars in a way in which they see fit.
Lots of available options, but Congress definitely needs to hear from small business owners themselves, like Marcie, about what is most impactful. Marcie, you are going to testify before several members of Congress here in a few hours. What are you hoping is the takeaway that they will keep in mind after you're done?
Well, I just want to make sure they walk away and recognize how important the small business market is, and to recognize that employers are trying to do the right things, and if you ask an employee, they want to have their coverage through their employer. There is a lot of challenge sometimes going and finding your own insurance, even when you do have some support from an independent agent. So ultimately, they want to be working through their employers, and employers need to be able to offer benefits for recruiting and retention purposes. They already have a tough challenge working kind of against the large employers. So for us, as I look to testify today, I just want to provide at least some solutions that right now can help to provide more options to these small businesses. We know, again, the cost of healthcare ultimately has to be addressed to really see those long-term effects and have meaningful change. But if we can make some of these smaller changes now to help these employers, that could be very crucial.
Before we go, is there any advice that you have for your fellow small business owners that might be trying to find affordable options for their employees?
Yeah, I just would encourage them to really lean into their agent partners and make sure that they are looking at all options that are out there. I would tell you that the ICRAs that are available, we're hoping to get some changes to those plans to allow them to be a little bit more accessible. However, we're recognizing a lot of employers don't even know what options are out there. So I would really just highly encourage them to make sure they're asking questions of their agent. And if they're not getting answers, it's okay to look for a new agent. So they should be working for them and advocating for them and their employees and really being thoughtful about any options that are outside of just a traditional health insurance plan.
Indeed. And we thank you for taking the time to go. We know that time away from your business is valuable. So thank you for doing that. Thank you for giving us a few minutes this morning on the podcast.
Yes, thanks for having me and allowing me to be a voice for small businesses across the country.
Before we move on, a quick break.
As of March 2nd, small businesses that do not file their beneficial ownership information reports with FinCEN will not be penalized. NFIB's lawsuit against BOI reporting is active, and the court has expedited its review of our oral argument scheduled for April 1st. Tune in to the Small Business Rundown next week for a bonus episode focused on updates and more details about the status of BOI in the courts and Congress.
Welcome back. U.S. Representative Kevin Hern is a champion for pro-small business healthcare legislation and a member of the crucial Ways and Means Committee in the U.S. House of Representatives. He's also a small business owner who knows the challenges of health insurance costs from the perspective of an entrepreneur who has signed both sides of a paycheck. Congressman Hern, thank you for joining us today.
So great to be with you.
Well, I'll jump right into it, Congressman. You have a deep personal connection to small businesses, being a business owner and an NFIB member. Can you tell us a little bit more about that experience, how it shaped your perspective on the challenges of small businesses and what they face today?
Well, I've been a small business owner for going on 40 years, starting out with an employee of one when I was in college many years ago. And, growing that to multiple McDonald's restaurant locations, over 1,200 employees just in that enterprise, but at the same time in the banking world, real estate development, all of this going on, by the way, simultaneously. So a lot of different industries, a lot of different employees. And, everybody wants to think that the entrepreneurship role is just, it's always roses, that nothing ever happens. But, I have to remind many of my colleagues up here, because my best estimates, there's really only about 10 or 12 members up here that really have ever been a true small business owner, which means, in my opinion, the truest definition is that you're the last to get paid, and sometimes you don't get paid, but you have to pay your employees, you have to pay your vendors. So that's how you really understand the meaning of risk. And, sometimes it doesn't work out. And as many of your listeners will know, if not all of them, you learn more from your failures than you do your successes. I can remember every single decision that, was catastrophic throughout my business career. I learned from it. I didn't expect the federal government to bail me out or give me some special treatment because I made the mistake. It's a little bit different today in many instances from a personal world. But business owners know this. And, I always remind people in America, as I talk to various groups like NFIB and others, and certainly my members of Congress, that there are no large businesses in America. I don't know about the rest of the world, but there are no large businesses in America that didn't start out as a small business somewhere. You can't name one, whether it's Google or Amazon, started in their garage, started in a dorm room. So it's so important that we understand the risk and the structures of small businesses and how we can make sure that our legislation and the regulations of America, the federal government, doesn't constrain you so much that you can't even get off the ground.
Yeah, it's a great point. And, on healthcare specifically, you've seen firsthand some of the challenges that small business owners face. What are some of those challenges when it comes to offering healthcare benefits?
Well, first of all, finding, something you can even afford. And then what is the proper split? Are you in a business that you can pass along some of your healthcare costs to your pricing of your product? Are you so competitive? As an example, you may have a construction company that you can, meter out those prices increases across, multiple lots, hundreds of lots, or, various products you're building. But you may also be in the world of McDonald's where you're in a very tight competition with other brands that you can't do that on the margin. It makes your non-competitive. So you look at this and then you see these, I remember back, when I was starting out many years ago, you could afford to pay 100% of the healthcare costs, certainly for the individuals that work for you. And as you got married, you could work with them on that. But as it continued to move forward and the premiums got so expensive, you had to start cost sharing, which makes it even more difficult on the employees on disposable income at their level. And so this got so complicated. And then you couple that with people working multiple jobs, and where does my insurance lie? Does it lie with me or the other group? Which one is a copay or a backup or a secondary plan? It's just gotten so complicated for the individual employee to figure it out. And I would argue for the employer to make sure that their employees have the best benefits that they can afford, because ultimately, when you're trying to compete, you may have, like companies, but it really is and will be your people that will differentiate you from other businesses out there.
And during your time in Congress, you've championed legislation to give small business owners more flexibility and options when it comes to those benefits that you're talking about, for example, ICRAs. Can you tell us what you think are the prospects for legislation like this, and if they have any plans moving forward?
Well, I think healthcare has been really slow in adapting to or adopting the ever-changing employment environment, the gig workers, folks that used to work. My father-in-law worked for Goodyear Tire Company for over 30 years and retired from there and worked one more job for another 20 years. And so he had health care. Today, you may have 30 jobs in 30 years. And, again, we wanted to look at sort of can you take your health care, how do you own the health care, not your company, but your company reimburses you, and adopted and really got, involved in the ICRA concept where you have this individual coverage that applies for you. You shop for it. You know what your employer is going to co-sponsor you with or sponsor you with in a direct subsidy or a direct payment to help you offset those costs. And so then you can move forward and you have the comfort that you're not locked in. And as an employee, you may be in a bad relationship with the company and you don't want to look somewhere else because that's where your health care lies. So I think it's both good for the employee and for the employer. It takes a lot of burden off the employer of trying to find the right plan for each individual employee, and it just gives you a lot of choice. And so, the choice arrangements, we also worked on, a plan that can be done in a shorter period of time so you don't have to do a full-blown ACA plan, and that gives the individuals, it's a shorter period of time. We think that President Trump and his team are going to look at both of these, and I think we can get them codified.
That'd be great. We hear a lot from our members about this and the flexibility that they need. So I know that they are cheering and hoping that we can get some of these things done. Before we go, for the audience of small business owners or supporters of small business owners, anything else you'd like to add, Congressman?
Well, I just want you to know you have a real champion in Congress and myself and others, but certainly I live and breathe every day the business experiences that I've had throughout my career. And I look at it from that lens because I really think the only way we're going to get our national debt and our deficits under control are going to be to get more people employed, more people using their creativity, being able to take that $1,000, start a business, and experience the successes that this great nation offers you in a free enterprise, a capital market environment. You can't do what you can do in America anywhere else in the world. That's why the American dream is so alive and well. You had never heard of a French dream or a Chinese dream or a Iranian dream. It's the American dream. And the reason it's the American dream is because you have this ability to go out and come from absolutely nothing like I did, start from scratch, never take no for an answer. It's always yes, I can, and you keep going. And when you get knocked down, you get back up again. And that's the truest definition of the American dream. I want to say thank you for all of you out there that are fighting this battle every day. I know the uncertainty is excruciating at times, but I want you to know that I'm your champion here, and I really appreciate everything you do.
Agreed. True champion for small business owners, Congressman Kevin Hern. Thanks for joining us today.
So great to be with you. Thanks again.
Josselin, before we go, anything else you'd like to add?
I encourage everyone out there who is struggling. I mean, I know all of us at some point struggle with health insurance, healthcare costs. But if you're a business, whether you are in the industry, like an independent doctor, a pharmacy, I know that we have challenges with competition and pharmacy benefit managers, or simply you have a story for how you want to be able to offer health insurance, get in touch. We're having a conversation as part of this initial hearing about the role that businesses, and in particular small businesses, play in promoting healthier communities. And we play a huge role. We are in every community in America and every main street. Our business owners care about their employees and they want to be able to help them live healthier lifestyles, more productive lifestyles. We just need the tools. And so there's obviously some hope out there for legislation that expands more options for health insurance that can lower costs. But we need to hear from our small business owners. So if you're a small business owner out there that is struggling with premiums, that has problems with their group health insurance and is looking for alternatives, or maybe you're a solopreneur and you're trying to figure out how to cover yourself and how to insure yourself. Maybe you're in the actual healthcare industry. Please reach out, get in touch, click on the link, tell us your story, and tell us how we can tailor our advocacy to make sure that your voice is being heard here in Capitol Hill.
Thank you, Josselin.
Thank you.
NFIB will continue to monitor this issue and encourage small business owners to share their stories with lawmakers. Individual stories and messages from small business owners are the best tool to inspire Congress to take action. The show notes for this episode will include a link to help business owners easily send a personalized message to your lawmakers and learn more about key healthcare legislation. If there's anything you'd like us to cover on the podcast, go ahead and send us an email at podcast@nfib.org. And now I want to thank you, the listeners, for joining us on today's Small Business Rundown. We'll be back every 2 weeks bringing you news and analysis from Washington, D.C. and state capitals so that you, whether you're a business owner or a supporter of one, can continue to blaze a trail.
The Small Business Rundown is brought to you by NFIB, the voice of small business. You can find us at nfib.com and on Twitter, Facebook, Instagram, and LinkedIn.